Hi, I'm Maeva, and this is Raising with the Village, the podcast where real parents share real stories so none of us have to feel like we're doing this alone. Because every story passed on adds something to our modern day village. In the last episode, we heard the first part of Louisa's journey, how she found herself pregnant in her 40s after years of uncertainty, and how that long-awaited joy quickly became clouded by fear when she was told that her baby may have medical complications. Today, we pick up right where we left off, at that emotional crossroads. Louisa talks about how she faced the unknown, made impossible decisions, and eventually welcomed her son into the world. It's a story of love, courage, and the quiet strength that often shows up when we least expect it. Let's dive back in and hear how Louisa's story continues.
I think though, thinking back, I don't think I felt like I had any other choice. No one was going to make the decision for me. People can give you advice, but it's not you. Like you can listen, but you make that choice. So it was either like crumble on the floor and be like, I don't know what to do. Or try to like pull myself together and make the best decision that I can. My husband was trying to support me in every way that he could, but he never gone through this. He didn't know what to do. He was used to me being the strong headed one. And he was like, whatever you want to do. And that was quite frustrating actually, because I was like, it's not just what I want to do. This is our life. So at some points I felt quite alone, and that online community really, really helped me through that.
And if you can share actually later on what those online communities or chats or Facebook groups were, that would be really helpful.
Yeah, absolutely.
Because I'm sure that it would be helping someone else be a little bit faster in finding their sort of support system. Now, going back into the pregnancy, now that you know about that, are they all of a sudden starting to tell you more? Or I don't know whether ask you about what the end of the pregnancy is going to look like, or tell you what the end of the pregnancy is going to look like.
They said I definitely needed to be induced because the NICU needed to be on standby. So they needed to have a bed. But I could have a vaginal delivery if I wanted. I had read online that and I had it in my head, I really didn't want an emergency C-section. Recovery would be longer. I knew that my baby would now be in the NICU for some time. So I needed to be up and running. And I didn't want an emergency C-section because the recovery can take a little bit longer. It was a lot of debating of I was like, if I have a vaginal delivery, is that going to be harder for the baby because his stomach's bigger, he's got a hernia? Is that going to hurt him? Is that going to rupture things for him? If I have a C-section, I'm going to be out of commission. I won't be able to drive. How am I going to get to this hospital that's an hour away? And I won't, you physically won't be able to do as many things initially. So it was really a lot of back and forth. I did have a chat with the doctor, and I was like, I think I might want a C-section. I think the NHS is not so keen on C-section. He was like, why? Don't you want to try? I really like this doctor, but I was just like, what do you mean? Are you saying having a C-section is not trying? So there was some of the things where I was just like, I didn't, it kind of irked me a little bit. But what he did explain was that, you can decide to have a C-section on the day, and it's not necessarily an emergency C-section. And that kind of resonated with me a little bit. So I decided, okay, I will have a vaginal birth. And then through the NCT classes, you learn all these other words that you didn't know, with ventouse and episiotomies. And I can't remember the other one where I was like, what is that? And when
This is plumbing.
yeah, and but there aren't even, when they don't even use words. They just do this scissors, like snip, snip. And I was like, how much? And I was like, oh my gosh. So,
This
yeah.
sounds a bit like a fairy tale when there's like the big bad wolf and you're like, snip, snip, okay. And this is how we're going to get the baby out. What?
I was like, oh my God, I don't want that to happen. Yeah, so it was it was a lot more scans. There were some concerns about my baby's heart. I think they called it a VSD, like a little hole. And depending on if the little hole is in the upper or the lower part, it has like different names and acronyms. So it meant like a few more scans. And I was like, oh my gosh, what is this going to mean? And they're like, no, don't worry. Like they're little holes. A lot of times they close on their own, but we will we'll continue to scan. And after you have the baby, we will, you'll be under care of a pediatric cardiologist. And it was just more. They were very reassuring. But I was like, okay, so this is another wrinkle so it was a lot more Googling. But they were all like, I started keeping almost like a medical notebook of like things I needed to ask, like when the baby came, like what do I need to push for? So that was kind of starting to build because you see so many professionals. You get a different midwife each time. On the best days, I'm not that great at remembering everything. So it was just it was like a medical journal of notes of things that I wanted to ask, things that they said that I needed to do, things I wanted to follow up on and ask more questions about. So yeah, taking loads of notes to try to keep things straight in my head and to keep going.
Can we now jump forward to the day?
Mm-hmm.
So on that day, does that mean that you started having contractions, your water broke, or what happened? How did that start?
No, none of that. So I had to be induced. So they gave me a date like quite late on, and like with the notebook and the planning, I was like, so when? And they don't tell you until really late. And they're like, okay, this is your date. You come to the hospital at this time. And I was like, okay. I had some contractions a few days before, but I thought they were Braxton Hicks. Like, I was like, do we go to the hospital? But you hear so many stories of like, you go all the way there and then you get sent back because they're like, it's nothing. And you don't know, like, if it's your first baby, I think even now with the second baby, I don't really remember what it was like. But at that time, I had no idea. I was like, is this a contraction or is this just a muscle crab? So I had no idea. And I was like, well, let me see. Because they said, like, does it regularly happen? I was like, I don't really know. Like, so there was a few days before I had a little bit of that. It was to the point where I was like, we might need to go. And I'm like, let me just wait a little bit longer and let me see. And I was like, oh, it kind of subsided a bit. So we decided not to go. So on in the day you get induced, we went to the hospital. Luckily I have a friend that lives by me that went through IVF, that had kids around 40, and she's like, when you get induced, you don't have the baby that day. It can be days later. And I was like, what do you mean days? I thought you go in and it happens. She's like, no, like they do different things. They do a sweep. They give you like this tampon looking thing, and it can be 3 days where you're just there chilling in the most uncomfortable place
Chilling,
ever.
yeah, I was going to say chilling. I don't think I've ever heard that word in that context.
She sent me photos where they went for a walk near their hospital, and it was like a hike. And I was like, should you be what if you have the baby like and you're in some field?
Were you like, oh, what should I pack then? Should I just pack my walking shoes as
I
well?
know.
And my walking sticks? Oh.
But like what? and you're in a shared room and like women are in pain and stuff. So it's just like, I was like, okay, mentally prepare. We got to the hospital. You're in the waiting room. There are women there heavily in labor, like in pain, vocally, like very much in pain that they're like vocally um out there. And I'm just sitting there and I felt so bad. I was like, I'm fine. I feel nothing. Like, I don't know. And then you get called up first and you're like, I think they might be a little bit more urgent than me. So you go in, and you go to this bed and you don't know, like, okay, is this where I am for 3 days or what's going on? Um, they, um, they checked how dilated I was. They're like, can I do a sweep? And they're like, oh, you're actually like, I think it was like 1 centimeter dilated. Have you had contractions? Like, well, maybe, but I thought they were fake. They're like, no, they weren't fake. Um, they did a sweep and then, I didn't have whatever the tampon thing was. It was they're like, "Okay, I think you're ready enough. You're moving to the next room." I was like, "Wait a minute. So I'm gonna have the baby today when after I prepared, like, I'm gonna have this baby in 3 days?" So that was, I was like, "Okay then, let me switch gears." Um, you go into this other room and they hook you up to the IV. I can't remember the drug that they give you to, induce you. It begins with an O. They're like, okay, it's just like, every half hour we'll increase the dose. And my husband and I were just joking around in that room. Like, do we sleep in here? Do we get like, this is a lot bigger room than I thought we would get. Like, oh, like, we were chatting, like we created a chat with my family, sending photos of us. And then, yeah, then it kicked up a notch and it was very quick, where the contractions came hard and fast.
It went from 0 to 1,000.
Oh, it totally did. I don't know what a non-induced pregnancy is like. In my head, I thought labor was like, 10 hours of like sustained, of pain. This was, uh, I feel I'm pretty resilient. I have a pretty high pain tolerance. This was there. And it was, yeah, it came really hard.
Oh, okay. I can feel the pain. Um, okay. So what happens at this point? Hopefully, tell me that they checked and you were actually dilating, nicely, or they came back and they were like, "Yeah, you are too."
Oh, no, no, like, I don't remember them telling me, but it was this baby's coming. So in total, it was like maybe 4 hours. Yeah.
Wow, this is super quick. Okay, so it
Yeah.
really, really worked.
Yeah, like, I think they don't put you in I didn't know, but it was a delivery room. They don't put you there because someone else might need it. They don't put you there unless you're like, for sure. So it ended up going from like me thinking I wasn't having a baby until like for a few days to like, no, you're in the delivery room. You're having this baby like now. Here's your card. Do you want, I'm forgetting the word for the thing in your back.
The
Epidural.
epidural?
Yeah, they're like, "Do you want an epidural? Here's all the risks of stuff." I was like, "Yes, I want an epidural." And they're like, "We'll try gas and air." And I was like, "What the heck is gas and air? Like, you're doing it wrong, but like you have to breathe deeper, but the deeper I breathe, like it was hurting more and it was a big like don't touch me. um so it was hard and fast. The midwives were changing shifts and I was like, you've got to be kidding me. Yeah.
Like I finally got used to you, and then no, you're gone. You're
Yeah.
going.
The
Come
the
back.
the midwife that I ended up having was amazing, like phenomenal. So it worked out for the best, but it was like the two ladies that were like your people telling you what was happening to you were like, okay, bye now. And you're hooked up to this machine that's like pumping you with drugs, that's like making you contract. And you're like, when does this stop? Um, but the second midwife came over, I was like, yes, I want the epidural. They're like, okay, let me get the anesthetist. That took forever. And then he came, and he was retelling me all the risks, but I was having contractions like every minute. And so he couldn't finish because I was having a contraction. And then he would start like rewind a bit. And I started being like, okay, so risk of paralysis, like keep going, like don't rewind because I'm never going to get there. I'm going to miss the window. I got the epidural. I don't, I'm assuming it kicked in because I didn't feel like everything that I assume you would feel. But I had the baby like 45 minutes after.
Woo.
Yeah, it went from
I was
like
there with
chilling.
you.
It went from chilling, texting, making jokes, figuring out how to open the chair to like this is game time.
Oh, wow. Okay. So we are 4 hours later and baby is out?
Yes, but before that time, your legs are in stirrups and the whole world is walking in. You're in pain. You kind of are just, she's like, you need to push properly. And I was like, I don't know what proper pushing
What do you
means.
mean? You did not push before? Like, did you not prep for it?
Yeah, I was like, she was like, but you're not pushing in the right way. And I was like, what is the right way? So it was, and then, yeah, it was like, you're not pushing right. You need to do the gas, like, breathe deeper with the gas and air. And I was like, this gas and air is doing nothing for me. It's just driving me crazy. And they're like, okay, we might need to, it was a few things. It was like, oh, we might need to, what's the, suction, the head suction thing? Is that Ventouse?
Oh, yeah, the ventouses, yeah.
Yes. Like, we might need to use that. I was like, oh, I'm going to have a cone head baby. And then you're like, oh, I'm in pain. He needs to come out. So they're like, this is where the midwife was brilliant. She's like, okay, well, let's just get it. But while we're getting it, if you work really hard at pushing properly, like maybe we won't need it. And she did the same. So I did get a bit of a episiotomy, the thing that I really didn't want. She's like, if you push really hard, yeah, like if you push really hard, maybe it's just a little snip. But she was like, snipping's better than tearing. So she was very good in like, if you do this, maybe I won't need to do it. If you do this, maybe I won't need to do it.
I'm feeling the pain. I'm feeling the pressure. I'm feeling the tension.
Yeah. And then in the meantime, there was like, I don't know, like 5 or 6 people coming in and out from the NICU, 5 or 6 other it was like a hospital tour coming through the delivery room. There was a doctor that would come, but the midwife did everything. I think the doctor just came to make sure because it was not like a standard delivery, but she would just come in, look, ask the midwife some questions and then saunter out. So there was just people coming in and out, but the midwife was like your person that was on this journey with you. My husband was just quiet at the whole time. The midwife was like, do you want to hold her hand? He's looked at me. He was like, I don't think she wants me to touch her at this time.
I like that. He was wise.
He's
was
like, I know.
I don't think now is the time. I'll stay at safe distance.
Yeah.
Okay, cool. So, yeah, of course, you mentioned the NICU team. So, of course, the NICU team had to be around. And that was the whole point since the beginning, that they needed to be ready to welcome the baby, assumingly pretty much from the second he was out, to start working on it and finally understanding exactly what the situation was.
Yes. And I think they didn't know, right? Because all his insides were all mixed up, not where everything was supposed to be. You don't know if there's like, is it going to be within the sac or could it rupture and not be in the sac, so higher risk of infection? Is he going to breathe on his own? Is his heart going to beat on his own? So there were a lot of unknowns where like they did do checks internally, but it seemed like they never really knew for sure. Yeah, I didn't even really think about that, like the whole world would be there. I knew that the NICU, like he would go straight into the NICU, but yeah, I didn't think that it would be like a team of like all these people that would come. I guess because you don't know what to expect, so naturally there's quite a few of them. But yeah, it was like everyone was having a look, having a view because your legs are in the stirrup. At some point, like I'm a pretty modest person, but at some point you're just like, I just don't even know, don't even care anymore.
I think at this point you just learn that you're like, this is what it is. come in, come out, walk in, walk out.
Have a look. What do you think?
Is that looking similar to the one next door, or are we? No, okay, cool. Uh,
Yeah.
okay, so at this point, the NICU is in. They're looking at the situation. They're like, okay, it's a bit of a jigsaw, but we're good. So are you able to actually hold your baby, or is your baby going straight away
Um,
to the NICU?
they checked the baby really quickly, and then we did get to hold the baby for a little bit, like less than a minute. Um, and then they take him away. And then they said you can go up and see him after. There were no like hour restrictions or anything like that. It was quite late in the evening at that time. I guess no one else was having a baby, because like it was all of a sudden it was very calm and relaxed. All the gallery left and moved on. They said the baby was breathing, like we heard him cry. So we felt a lot of relief then. Then you have to deliver the placenta, and you look around the room and it's like a disaster zone, and it's just you, your partner, and the midwife again. Like it just dramatically like went from a height to like really calm. And she's like stitching you up, and you just look, you're like, oh my God, this poor woman needs to like tidy everything up, tidy me up, but like tidy the room up and like do all this stuff on her own. And I don't remember what time it was, like, I don't know, 11, 12 o'clock at night.
Oh wow. Okay. So your partner stayed with you, or did he go away with the baby?
He stayed. I don't think they allowed him to go. Like they didn't give him a choice. They were like, no, you stay here. You can come after. So we don't really know what, like in hindsight, now, like looking back, maybe it's for a different, podcast, but you kind of go with the flow because these people know what they're doing. And it wasn't until quite a few weeks into being within the NICU that you learn, okay, this is what you do to learn what you need to learn, because they don't always tell you. And this is what you need to do to advocate. But at that time, it was like they just told you and you just went, okay.
Actually, I think now is probably the perfect time to talk about that. So, what would you do differently now that you know?
I would ask a lot more questions. I would ask, when do the doctors do their rounds? When do the nurses change their shifts? I we didn't figure that out until later. And if you're not there when the doctors do their rounds, you don't know what's going on. And um, Luckily, we were at a very good hospital, the very good NICU unit. Like, I feel like if I had said, like, I want to speak to someone and I want to know, like, the story, in hindsight, like, they would have stopped to do that. It also took time. I think I probably would have done more research about, like, the different doctors. Um, that were in the unit. Um, we kind of learned that over time. We knew who was more aggressive, who was more conservative, who was the specialist in this area, who was not. But the round times were really important. So you know what they're saying to each other and what's happening. Because my son was full term, he was the biggest baby in the NICU. Like, it was full of like twins, preemies, and stuff. So it was funny. They would come, they're like, "Oh, he's full size." So he maybe it's not the same. Right. So there were a lot of days where it felt like nothing happened. He was just there. They were monitoring. He was under surgical monitoring. They were waiting for skin to grow. They were waiting to see what was happening. He had very bad reflux. So he had issues with feeding. So he had feeding tubes. So it was mainly like getting the feeding right, making sure he doesn't get infection. It was that kind of stuff. So it was a lot of the days kind of started to bleed together where you kind of didn't know what was happening. You kind of took what they said, like they're upping his feed, they're decreasing his feed, like all this stuff. And it was only like later that you kind of work out, oh, there's a formula to work out the feed. Sometimes they get that formula wrong. So it was really, yeah, like it was like learning on the job where you're always listening to try to figure it out. I think in hindsight, I would have asked a lot more questions, been a lot more pushier. And you can do that in a, like in a nice way. But I really learned that you really do need to advocate for your baby, and for yourself. Because everybody's stretched, like especially the NHS, people can make mistakes and they're trying to take care of all these babies, and there's a hierarchy of risk. Like if you think about how you approach like work in that sense. So yeah, just I think being aware of that, and then you're able to, when they make rounds, also ask them questions. Find out what did they do, like what is the current care plan? If this happens, what would be the plan? That type of thing.
What was your baby being fed for?
It took a little while for my breast milk to come in. So he was on formula. It was all a mix. I think when he was in the I don't remember, like the most the highest level of NICU, they had given him formula because I didn't have breast milk. They gave me an option of having donor breast milk. I felt a little bit funny about it, and I felt a little bit like a failure in that, like, I'm not able to produce breast milk. You read these things that, like, it's better for your baby. He's struggling. Like, he's not coming in with his deck stacked, right? So I opted for donor milk until my milk came in. Um, I so I was doing that. And then I guess if we fast forward a little bit, I uh it was um it wasn't it was always pump, and then you give the milk to the nurses to give to your baby. So he was bottle fed. Later on, we did try breastfeeding. I did breastfeed for a while, but I never had enough of a supply. So quite quickly, most of his um, most of the months when as a baby he was combination, so a mix of formula and breast milk.
And another question that I had, which is more on the practical terms, is where were you living during that time?
An hour from the hospital. So for me, after delivery, I got released after one night. So like the next day, they're like, you can go home. And I'm like, well, what do I do with my baby? He's still in the NICU, and I don't know how long he'll be there for. Luckily, the hospital has a charity, and they have one room outside of the NICU units, that if nobody's using, like it's like if no one's using, you could potentially use, but you might have to give it up the next day. And then there was like a Ronald McDonald House near the hospital that you could also try to go for. Luckily, there was the room outside of the NICU that we could use for a few days. So we did that. And I didn't leave the hospital. I didn't leave the floor. It was the room. And then I sat next to him all day. And it was through sitting with him all day that you kind of learn the schedules. But yeah, and then when we had to go back home, it was driving to the hospital in the morning, and then coming back at night. So, and then when my husband had to go to work, I just did that. So we did that. He was in the NICU in total, like through the different units of NICU for 2 months. So for 2 months, it was like going to work. In the morning, I'd go, and then my husband would take the tube and meet me at the hospital, and then we'd drive home at night about 8 o'clock, and then we'd come back the next day. I found it incredibly hard to leave him, to leave the baby um, there, um, especially if you knew the midwife on shift wasn't going to be as attentive. Nobody's as attentive as like you are, but not as attentive as some. So if there was going to be like more vomiting because they put him down quicker, and then they're going to reduce his feed. So there was a lot of that roller coaster.
Oh, gosh. Okay. So it's 2 months of that, of work, essentially, starting your new role as a senior mum.
Yeah.
No joke intended here.
Yeah, basically.
I meant as a fully qualified mum.
Yeah.
But so after 2 months, baby comes home. What does life look like at this point?
If I could mention one thing, first, in the NICU, there was a breast pumping room, where all the moms go. And that was such a network for me. There were only a few moms in there at one time, but basically it's what you sat by the bedside. And then, every few hours you go to the breast pumping room and you sit by the pumps with all these other moms and you have a chat, and life felt normal when you were in that room. And I met some great moms there. So I don't know how people, like, if you're not breastfeeding and you don't happen to do that, how you do that, because you spend so many hours, so many days there, at was probably the most emotional time in your life, the most stressful time. And you don't, like, when you're sat in the room where the babies are, nobody's chit-chatting because everyone doesn't know everyone's situation, and it's not really the type of environment that you're conversing. So it's really like just that breastfeeding room. There tends to be like a family area as well, so I would, if anyone's in that position, like, try to use those areas. They do have like sometimes talks and things like that. But to your question, coming home, it was a roller coaster because they told me that we could go home, and I had to be in the room with the baby for a few days before, like, this is leaving special care unit, and there were like other moms, and basically you have to take care of the baby, and the baby has to gain weight, and if the baby doesn't gain weight, then you can't go home. So it was such a stressful time, and you spend all day in that room. And I'm like, how do I go to the bathroom, because I can't take him with me to the public hospital bathroom. So you'd have to like go in and get a midwife to come, but they're busy, and you're standing there and you're like, but I'm going to pee myself. So it was like all of this, it was very stressful, because you're trying to do it on your own, but it's not your setting, and there are rules, and you're dependent on other people that have other priorities. So there was all of that. And they're like, oh, at the end, they're like, your baby's gained weight, you can go home. And then the surgical nurse said, can you stay the weekend? Because I want to, like, have more of the arrangements in place before we release you. I broke down. I was like, I really can't do that because I'm like mentally set to go home now. I'm done. Uh, uh, she made it happen. I'm so grateful. She made it happen. We went home. And then I was like, oh my gosh, there's nobody now. Like, I need to, like, there's no midwife, there's no nurse, there's nobody now to tell me if what I'm doing is right or not. And you have to stay up with the baby now all through the night. So it was that kind of, I was so happy to be home, but then that kind of hit quite quickly.
Did you have a support system in place to help through that period of coming home? Because to your point, all of a sudden you go from having an entire NICU team
Yeah.
supporting you, obviously you and other babies, but you've got a whole lot of professionals to being you. So you are the professional of your baby, you and your husband, but your husband, assumingly at this point, is back at work. So most of the time it's you. So did you have any sort of support system helping you through that period?
I Not really. No, I did not. My All my family's in the States. My in-laws live a few hours away. They're they want to be grandparents, but they also themselves didn't grow up around lots of children. They were not necessarily very hands-on at the time. Like if we asked them, like they could come, but they have very full lives. So no, I had the online Exomphalos community. I did have my NCT group, but it wasn't what people tell you. The NCT group, I was a lot older than everyone else. Um, I had this complication with my baby that people just didn't want to talk to you about. Like they had a different experience that they bonded over. So we didn't have like that strong connection within that group. It was helpful like when you're doing like your 3 a.m. feeds and you're wide awake to have someone to text. So that definitely um was was nice, but there wasn't really anyone at that time to do it. But I was just so happy to have my baby at home, for him to be healthy. Um like at the time it felt huge. Looking back, it was like the only issue he had was like reflux. Like he had to gain weight. We had to work hard at feeding him. But if I think back to the beginning of the journey and when they were telling me all the things that could have happened, we're actually very, very fortunate. And I felt very like this is a lot of people have it a lot harder um, than me. Like this, I can do this.
It was a happy place to be with your baby, but it was also a fairly lonely place.
Yes.
And now that you've been through that, is there anything yet that you would do differently to take you out of that sort of daily shift, and take you out maybe into something that looked a little bit more like normal early days with a baby?
Um, we'll see with this with this pregnancy. It'll be trial and error. I think I think it's natural to take time to settle in, to figure out what your routine is and to get comfortable. Um, I think this time around, I will try to get myself to leave the house sooner, to take the baby to different places. I think like getting out, getting fresh air, interacting with people. I feel maybe it's because I'm paying attention a lot more, but it was later on when my baby was a lot older that I started going to library rhyme times, like doing baby sensory classes. Um, and you're not going to be best friends with everyone. But it's really through those interactions that one, you get out of the house and you smile and you do something fun with your baby, rather than like being at home and the stress of like, what do I need to do next? What do I need to do next? And all your chores. I think that's really beneficial for you and your baby. And it was when I got to that point with my son, that was when I kind of like, okay, this is what it's about, right? Like I know I will have to go back to work. This is like the enjoyment period and not feeling like it's a job. It took me a while to get there. So I think with this second baby, I am going to try to leave the house, and it starts with baby steps, right? Maybe it's just like going out to like the front or the back of your house and like doing one loop around the block to get used to being out, and then kind of going further from there. There are also now a lot of different mom groups, like for when you're pregnant, not just NCT, and for when you first have the baby. I think I've come across so many moms that are so adventurous, like going into central London, like with their buggy with twins and some triplets, and going on walking tours, and things
Oh,
like
wow.
that. Yeah, like, and whatever your interests are, like if it's like history about London or like art and stuff, like you bring your buggy and you go with all these other moms. It's fantastic. Um, Things like that that I did later, but there were moms there with like, yeah, it was like triplets. And I'm like, okay, I feel bad complaining about not having sleep with one.
Are you feeling lazy all of a sudden? Like, all right, you're doing it with triplets.
Yeah, but you also learn a lot more, like, when you start weaning, I was like, "What did you do? What did you make?" Or, like, I'm like, "Oh, I don't really have time," or, like, "I'm not really a cook." They're like, "Oh, you could do this. This is so easy. You just put stuff in a blender." Like, you just learn a lot more and build bonds that way, and it's fun, like, the socializing aspect of it, and your babies can kind of get used to being with other babies, and it felt like living again rather than surviving.
That's really cool. I really want to meet with that mum of triplets now.
Yeah.
And I want to know more about those art tours and like
Oh,
architecture
they're
tours.
fantastic. Like, even just to get your steps in, right? Some of the stuff I was like, "Okay, don't really care about that." But, like, some of it is very interesting, and it gets you out and exploring.
Slowly starting to wrap things up. At the very beginning of the conversation, you mentioned that you are now 21 weeks pregnant.
Yes.
So what was the thinking then for that second pregnancy? How did you go into it this time?
Um, it was I wonder if, it's very common for people to have, like, a 2-year type of age gap. I wonder if that is when you start to forget, like, the pains of labor and being 3rd trimester pregnant and walking
Is
really
it what it
funny.
is? It could be.
There was because I started to, like, not really like, preparing for this, I was like, I kind of don't really remember exactly. I think, with what we talked about, earlier, I wanted my child to have a sibling. I look at my experiences with my siblings. We didn't always get along, but I wouldn't. I think looking now, like we're such a support network for each other, and even now when we each kind of have our own like separate lives and stuff, and I want my child to have that experience. And I, w- I, yeah, I want more than one child. And I think it is I'm 45. My back hurts. It takes me time to straighten up when I get out of a chair. So it's all of that where as much as I don't want to admit it, as much as internally I feel very young, obviously, physically you start to see signs that are a little bit undeniable. And I don't want to work for the rest of my life. I would like to retire at some point. Um, and um, and so it was, we were like, okay, I think it was the renewal, because when you have frozen embryos, they come with you, they come to you for an invoice to say, what do you want to do? And it was during that time, we're like, okay, because we still have 4, we didn't use them. So what do we want to do? I'd been at work with my company for quite a few years. There's enough flexibility where it is probably one of the better places that I could be at to make it work. Um, and yeah, like y- you feel like you start to feel like you have the hang of this parenthood thing. You never fully get it, but like you're like, okay, this is okay now. Maybe we can handle another one now. So that was kind of a part of the thinking going into it. So this one is a frozen embryo transfer. And we were prepared because it doesn't always work the first time, but we've been fortunate where so far everything's looking quite good.
Congratulations.
Thank you.
That is so exciting. So, what are the, very high level, but what are the differences between this time and last time? Do you have any more tests? Are they checking things specifically in the light of your first pregnancy?
I don't think they've done anything differently. I think being 45, again, under care of your pregnancy's under care of consultant. So I saw a consultant once and I'll see them once again. You're on aspirin. I think when you do your nuchal scan and the blood test, your age is a part of the formula, so that most likely you will come back as high risk, which definitely scared me a little bit. It came back as high risk, but they explain like you start off with a higher baseline because of your age, and then they look at the blood test, and then they look at the scan, the fluid results from your scan. I came back high risk, and then they offer you another blood test. I was like, but I already had a blood test. Why do I need another blood test to test for anomalies? Like, what's the difference? And you have a choice, right? You can go through the amnio CVS route, or you can have another blood test. And with the amnio CVS, there's a chance of miscarriage. Basically, the second blood test has a higher degree of accuracy. I'm guessing it's an NHS cost thing. Because in my head, I was like, why wouldn't you give me that in the beginning, especially given my age, if it pushes everything up? So I'm like, at the end, do you end up saving money? So I don't really. So anyway, I had a second blood test and I was preparing myself. I did ask in the scan if they saw any. It's not the anomaly scan. I have that coming up. But I asked, like, do you see an exomphalos? Do you see a closed abdomen? Like, I don't see any abnormalities at this time. So I was like, okay, like, what are the chances of that like happening again to me? Yeah, I had the second blood test. Thankfully that came back clean. So I think for any of the older moms, and if you're going through NHS, just know that the first test may come back high risk, but ask them. What was explained to me was higher baseline because of age, and you kind of need to hold your nerve, go through the second test, and well, you have to make a decision. Do you want to do the CVS amnio, or have the second test? If your second test comes back low risk, you're not offered that again. So there's kind of trade-offs with that.
What can we wish you for this pregnancy?
I forgot to mention, what like I didn't know with the second pregnancy, everything comes earlier. Your bump shows earlier, the pains, your back pain, you start waddling earlier. I did not expect that because I didn't have that until like the third, like quite late in the third trimester. I think all of that is to the side. The main thing is to have a good delivery, a healthy baby. Wish me luck for the first time bringing a newborn home, and being on my own with such a young baby, which I didn't experience the first time around.
Yeah, hopefully it's going to be a whole lot of first times, exciting first times.
Yes.
The first time that you're not going to sleep through the night at home, and not in the NICU.
Yeah.
So very different. No, but that's really exciting. I'm really excited about that. I'm really looking forward to it for you. Is there anything else that you would like to share?
I think just even though you go through your experience is individual and specific to you, but if you do end up in a situation where you don't have your family immediately there, or if they're not who you go to, it's weirdly strange how much you could open up to strangers going through the same experiences, and the strong bonds that you can form through something like that. So give it a try. I think somewhere someone is going through maybe not the same, but it's somewhat of a similar experience to help you go through it. Even if you think you know everything, it doesn't hurt to have someone to talk to about it.
Exactly. We're all looking for that village.
Yes.
We want to be raising with the village.
Yes. Create your own village if you don't live in one.
Exactly.
Yeah.
Exactly. That's what we all want. That's what we all need at the end of the day. If you could say one thing to the Louisa of a few years ago, what would you say? And actually, when would you go back to? Would you go back to Louisa just married, age 31? Would you go to Louisa, age 35? Or would you go to Louisa, age 38? And so on and so forth. And what would you tell her?
The stars are never gonna align. Your time is your time. I would not change when I am having or had my babies. And I think I would tell myself to trust myself, that you're resilient. You will find a way, like whatever curveballs come, like you'll work through it. I think just like so many other strong women that are out there, like you will find a way. Think of all the things that we navigate through daily life and how many things we juggle at one time. Whatever comes, like we will find a way.
I'm loving that. I think this is strong. This is powerful. All right. Well, thank you very much, Louisa, for your time.
Thank you for having me. I've thoroughly enjoyed it.
That was such a great conversation. So much information, so much to learn there. Really rich. Thank you so much for sharing with the village. And
Thank
speak to
you.
you very soon.
See you.
Bye.
Bye.
What a journey, right? Louisa's story is such a powerful reminder that even when life takes us down unexpected paths, like fertility challenges, medical complications, or just timing that looks different from what we imagined, there is still so much love, strength, and joy to be found along the way. If you'd like to find out more about some of the things Louisa mentioned, you'll find links and resources in the show notes for this episode. If you've gone through something similar, or if Louisa's story made you think of your own experience, I'd really love to hear from you. Raising with the Village is all about building that space where stories are shared and passed on, so we can learn from each other, support each other, and remind ourselves that none of us are doing this on our own. You can find me on Instagram at raisingwiththevillage or through the website raisingwith.co.uk. That's also where you'll find the links to all the podcast platforms. And if you haven't yet, don't forget to subscribe to Raising with the Village on Spotify, Apple Podcast, Google Podcast, Deezer, or wherever you find your podcast, so you don't miss any new episodes. There's a new one every Thursday. Thank you so much for listening and for being part of the village. Bye-bye.